Hello, everyone. Welcome back with Talk with Terry Tuesday. I am Dr. Tony Scott Terry. I am the owner of Allure Wellness Center here in Tinley Park, Illinois. First of all, let me say I hope all the mothers, biological, non biological, aunties, had a wonderful Mother's Day because we deserve it. We deserve a day where it is just a day for us, a day for you to be celebrated for all the things that you do for your kids, other people's kids, because we are a village. And so we are all participating in the raising of these children. So happy Mother's Day. I hope you had a wonderful and joyous day. So we're going to dive right in because May is Mental Health and Skincare Awareness Month. So today, I thought we would focus more on mental health and tools that we can do, how to recognize what's going on. Now, let me say this to begin. I am not a psychologist. I'm not a psychologist. I am a gynecologist, but I have been doing this a long time. So I'm familiar with mental health, but I'm always going to refer you to someone who specializes in it, who this is what they do. But I'm going to give you some pointers and things to look out for and things that might help you through this journey because your mental health affects everything that's going on in your life. So we want to focus on May is Mental Health Month. So we're going to focus on give you some tools. We have oh my God, we probably have about 15 therapists that we refer to. So if you need a mental health therapist, then please don't hesitate to contact someone. Most of your insurance plans will give you options. People can do in person, they can do telemedicine videos, whatever works for you. But you've got to get your mental health in order because if you don't do that, then it's going to start to affect you physically. So let's talk a little bit about mental health. Um, Most people may or may not know anxiety is the number one mental health disorder. And a lot of people have it. We see it more as we get a little older. And some of that may be hormonal changes, and that's men and women. We have seen a correlation between drops in hormone levels and mental health changes, especially anxiety. So some women will have, especially younger patients, may have premenstrual syndrome symptoms. So they get a little bit more moody, they get a little bit more depressed. A lot of that centers around drops in hormone levels. Now, every hormonal change does not cause mental health concerns. So let's just get that clear. But there can be, when you have lower levels of hormones, that can affect you, how you feel mentally. Um, there are, because a lot of people don't necessarily like to talk about mental health, or it's getting better. But what I tell people is for our men, they are having a really high rate of suicide. And what I tell people is that society for so long has made it where men couldn't really talk about their feelings. Like that was, you weren't strong enough if you had to talk about your feelings. That's incorrect. So you are human as well. So if you have a male that is in your family or a friend or anything like that, and you think that they may be struggling, and there are subtle signs, but if you think that they're struggling, please, please, please try to get them some help. We have male therapists as well if they're comfortable with it. In June, I think we're still doing it, but I have to check with my husband. We do a men's health retreat, and it's just for men. They talk about anything from mental health to physical ailments. So if you think that you are having some changes that are going on, you don't feel like yourself, you're sleeping all the time, you don't want to do anything with your friends, you're isolating yourself. Those are some concerns. that maybe something may be going on and we may need to address it. So these are little things that I have picked up. Um, there's a five, or no, not five. There's a 3-second rule for anxiety. And what I tell people is there's three things that we want you to do. We want you to pause. We want you to take a couple of deep breaths, and then we want you to look around at your surroundings because it makes you more aware. It puts you in a space. Taking deep breaths brings in oxygenation. It actually helps bring down cortisol levels, which are stress levels. And sometimes just stopping for just a couple of seconds will give you that space to kind of regroup. Um, a lot of people may or may not need medications. What I tell people is that if you are struggling and you've tried everything else, there's nothing wrong with taking medication. If you had high blood pressure and it was uncontrolled, you would take the medication. If you have mental health changes and nothing else is helping, then medication may be an option. They have so many newer medications that may not cause the same side effects. So probably a lot of popular ones that I've used on my clients and patients has been Zoloft is a popular one. Lexapro, Prozac has been around for a long time. It doesn't mean that you have to be on these medications for a lifetime, but you may need to be on it for a period of time in order to get you to or through that phase of your life. Some people may need to require it for a lifetime. Everyone is different, but it is a medical issue. If you had high blood pressure, if you had diabetes, you would take the medication to treat your medical condition. Mental health can be a medical condition, and if medication is what's going to treat you. We start with lifestyle changes with diabetes and high blood pressure. Same thing for mental health. We start with lifestyle changes, but if you need to be on medication, please. If it makes you feel better, then that may be a route that you may have to choose for a short period of time. I'm going to give you some little tidbits about some superfoods that may help you with some of the anxiety, that may help you with some of the depression. I'm not saying this is to replace medication, but it may help you. Okay, this is going to be a favorite for a lot, but still be cautious with it. So, dark chocolate is one that may help you. That's why you feel better after you actually eat some chocolate. That actually helps release chemicals that actually stimulate areas in the brain that make you feel better. Sweet potatoes, salmon and clams, nuts, mushrooms, high quality protein, healthy fats like avocado, olive oil, leafy greens. Those are some of the that actually help improve your mood. Some of the other things that may help is chamomile tea, green tea, ashwagandha, water. I can't say enough about water. So one of the things I tell all of my patients, before they leave here, I'm going to ask them, are they taking vitamin D? Are you drinking enough water? 64 ounces is 8 glasses of 8 ounces. That is the basis, as she shows me her cup. That is the bottom number of how much water you should be drinking. That's your minimum. You should be getting 64 ounces of water every day. If you drink caffeine, add on however many ounces of caffeine you just drank to the 64 ounces of water. It helps your total body overall. There are some other things that kind of help. So, like I said, chamomile tea, green tea, a lot of people already know this. It helps you relax. It actually helps, like it stimulates L-theanine. So I've also talked to a lot of my patients about when you're actually having mental fogginess or you're feeling kind of moody. L-theanine is something that you can get at a health food store, and it may actually help trigger dopamine release. Dopamine makes you feel better. Some other things that you can do is yoga, stretching, meditation, exercising. These things physically help you release natural dopamine that makes you feel better. So there are a lot of people who are addicted to working out. Not a lot of us, but a lot of people are addicted to working out. And it's because it releases these chemicals that actually make you feel better. For my patients, once again, I am not going to tell you that if your doctor thinks you might need to be on medication, then I wouldn't completely dismiss that. But there's some other things that people have tried as well. Um, Not all, we're actually going to start doing a little bit more of it, probably in the next several months. But IV ketamine, there's also oral ketamine. This has to be done in a controlled setting. It actually helps people with resistant depression, PTSD, chronic pain. It's been used for a lot of treatments that actually helps stimulate certain areas in the brain that unlock those areas, and it kind of not redirects, but it changes the synapse so that that depression or those feelings that you have deep inside, they make you think of it differently. And so you're not as depressed. You're not having a lot of PTSD. So I'm not saying it is 100% cure, but these are some other alternatives that people can do to actually improve their symptoms. There's another device. It's a transcranial magnetic stimulator. What this does is this is done. It's not invasive at all. There's something that you actually place on the head, and it stimulates neural connectivity and will stimulate brain nerve cells to function better. And so this is something that, well, there are different devices. There's a newer one that just came out called ExoMind, and they have been doing different studies with ExoMind, but it's about a 30-minute procedure. It is not painful at all, but it actually changes the synapse and change how you process it. There are some people who are low in certain chemicals, and that may make them more prone to developing depression and maybe anxiety. This may help to release those chemicals a little bit more and a little bit better so that you respond differently. So, once again, the therapist is someone who is your friend. Not every therapist is going to be the best therapist for you. You have to, like anything else, you have to see what works best for you. So if you've tried one therapist before and be like, oh, that didn't work for me, that may have just been that person didn't work for you. But therapy actually works. Even when we do these treatments like ketamine or the transcranial magnetic stimulation, I still have people talk to a therapist because you've unlocked all these things with doing these treatments. Now, who are you going to talk to it about? Once again, I'm a gynecologist. I like talking to you all, but it is not my specialty. So I like to send you to people who this is their specialty, this is what they do, and they can assess you. So if you're doing any of these treatments, like the transcranial magnetic stimulation, or you're doing ketamine, you should also have a therapist that you are actually talking to. If you are on medication, you should have a therapist that you are talking to. Just doing medication alone, or just doing these other treatments alone is not adequate. You have to unlock those things. So I wanted to make sure we spend some time on mental health because there's so many things that people don't know that are available to them, and they're suffering. And so if you have a friend, if you have a brother, if you have a neighbor that you're concerned about, please try to get them some help. There are also hotlines that you can call that are free. So if you need any of that information, please give us a call. You can DM us and we can get you that information. But we want to make sure that we really do keep mental health top of mind because it's important for us to know what we can do and how we can get out of that state. So I think that's all I have for today. Oh, I looked up this thing. It's called the 5 C's of mental health. So one is coping. How is your community or your support system, your connection to other people, self-care. Do you go get a massage? Do you take a minute to meditate? Do you go out for a walk? Those are things that are self-care and compassion. So we have to kind of like use those 5 C's of mental health: coping, community, connection, care, compassion. If you're isolating yourself, it's going to be hard to get out of that state of mind by yourself. Sometimes going and surrounding yourself around people may help you kind of get out of that state of mind. Find a person that you feel comfortable talking to. But once again, talk to a therapist if you think that you're not yourself, you're feeling very different. And then I also have a lot of my therapists will actually send patients to me to have their hormones checked because that can also be a factor. So that's it for me. We can see if people have any.
Can you recommend a therapist?
We can. And once again, we have about 15 therapists that we use. Some of them actually do only telehealth or video. Some of them do in person. Some of them do both. So we do. If you are looking for a mental health therapist, we actually have a mental health therapist that is in the facility. So, and he does do in person on Monday. So we can get you his information. We have other people who are around the city. They're not just here. But so if you need a mental health therapist, just give us a call and we can get you that information.
Okay. And you had a comment from Brenda. Thank you for this valuable information.
Absolutely. It's important. We Nobody likes to talk about it. I think we're talking about it a lot more, especially since COVID. But we have therapists for kids as well because they're struggling. The social media thing is really, really affecting them. So even if your child is struggling, there is nothing wrong with your child seeing a therapist. And we do have some child therapists that we refer to as well. We have psychiatrists, we have psychologists, we have mental health or behavior health therapists. So we have several therapists that we can refer you to if that is something that you need.
And Brenda is your cousin, Brenda Casper.
Hi, Brenda. Okay, I can't really see. So, thank you for your comments. So hopefully this was helpful. If you have questions, if you have concerns, please let us know. We can try to get you the information so that you can get assistance. So, I am Dr. Scott Terry. Thank you so much. Our next Talk with Terry will be Tuesday, June 9th at 1 p.m. But before we, wrap up today, we would love to hear from you. Leave us a comment. Let us know what topics you want to talk about next, and we'll try to accommodate as best we can. But to end the show, we just want to always make sure for you to be well, be blessed, and be healthy. And we'll see you next month.